Hello class, batch 24, unit 4. Today the lecture will be on dental public health issues and challenges. The content of this lecture will be 1. The outline and issues and challenges in the Malaysian healthcare system. 2. Healthcare affordability, accessibility, availability, acceptability and appropriateness. 3. Key healthcare indicators. 4. Policies to reduce non-communicable diseases. 5. Privatization and role of government in healthcare. And lastly, outline the key oral health goals of year 2020 with major strategies. At the end of this lecture, it is hoped that students will be able to explain the various issues and challenges in achieving oral health goals, describe the ideal healthy settings conducive to health, and to point out the major strategies to achieve the key oral health goals by 2020 in the Malaysian healthcare system. As an introduction, we go to what is actually the Malaysian healthcare system. Malaysia has a dual-tiered system of health services, which is one, the government-led and funded public sector, and secondly, we have the private sector. The heavily subsidized public sector is almost entirely borne by budget allocations, with patients paying only nominal fees for access to both outpatients and hospitalization. The private sector caters to most of the fee-for-service self-paying public, which include private sector employees through panel doctor contract or insurance arrangement. The Ministry of Health, or short MOH, is the primary provider, financier and regulator of health services, and hence it is responsible for the population health and the implementation of health promotion. This is an overview whereby you see one section which is public health sector, and we have the personal health care, which is also includes public and private. And for the public, we have the government Ministry of Health, and we also have the local authorities and other ministries which are also providing healthcare. And here we show the system of the payment and the funding sources. Okay, the Ministry of Health has a mission and a vision, and this is actually a nation working together for better health. And in the oral division of the Ministry of Health, it is the lead agency in the provision of oral health services and the development of legislation concerning oral health care in Malaysia. When we talk about issues and challenges, actually we are looking at the outcomes, which is at the end of the whole spectrum, which is the oral disease and the non-communicable diseases burden. And the determinants will affect the outcomes, and issues are related regarding structural determinants, intermediate determinants and proximal determinants. We also have the other important determinant, which is the commercial determinants. So when you look at the broad spectrum, you see a lot of things which will affect the health outcomes, and issues will come from all these sections. So for oral health, when we group all the determinants, we see that we have economic, political and environmental conditions, social and community contexts, oral health related behaviors and individuals, which will finally affect the outcome of oral health. challenges that is involved in the implement of any success or failure to oral health will be affected by political problem, legal problem, material problem, prospective and organizational problem. So these are the issues and challenges in a broad view. So why is dental health so important? Because oral health is a key indicator of overall health. So as we know that most oral diseases and conditions share modifiable risk factors with the leading non-communicable diseases. So these risk factors include tobacco use, alcohol consumption, and unhealthy diets high in free sugars, all of which are increasing at the global level. Issues and challenges as depicted in the overall overview, we find that demographic and disease pattern transitions, increasing costs of healthcare together with increasing demand towards better health outcomes, historical based healthcare financing has also created inequity in access and located inefficiencies, equity access issues such as uneven human resource distribution and limitations in secondary access to consult specialists remain a problem despite generally improved access to facilities. This is especially for the rural populations. Urbanization, however, has created vertical inequity and strains to existing public health facilities. Inadequate availability of public health facilities and manpower has led to a proliferation of private health facilities. And at the end of the whole thing, there are issues on unethical prescribers' behaviors, queue jumping, and dependence on profit-oriented private healthcare providers. So, from the issues and challenges, in diagrammatic form, we have the aging population, which is really giving a lot of challenges for the healthcare system because there's an increase in the percentage of oral old age groups. And with aging population, there will be needs for a lot of geriatric care, domiciliary care, nursing, rehabilitation, nutrition, medicine, counseling, social protection, support group, oral health care also, education, awareness and health promotion. So, inadequate services, facilities and human resources to meet the needs and financial sustainability, especially when you have a lot of chronic diseases which will incur high costs. So it is estimated that for urbanization, 80% of the world's and Malaysia's population will be living in urban areas in the year 2030s. So cities will be densely populated. At the end of it, what will be affected is also the scarce financial resources. There will be increased healthcare costs and expenditure of health and GDP will be affected. Then in the issue of quality and safety, whereby there will be in the public sector there will be a lot of long waiting time because of the overload of patients. And ICT issues and challenges include inadequate and inconsistent funding, fragmented ICT implementation in MOH, incomplete readiness of ICT infrastructure at health facilities, inadequate data for strategic planning and management, and inadequate ICT skills and competencies. The current trend now is what we are facing, which is the coronavirus disease. which is COVID-19, which is currently a major public health problem globally and posing significant economic, social, health and environmental challenges to countries. So the pandemic resulted in serious financial problems faced by dental offices, hospitals and healthcare operators, in which dental interventions are limited to urgencies and the management of patients has become expensive and unpredictable. So now we are in the new norm whereby modifications in oral health care delivery process from the patient's registration to treatment and training method has to be adapted in the workplace until a certain period of time or until the pandemic is over. There's a need for isolation rooms, proper ventilation and suitable equipment to provide safe treatment to patients. Whilst this public health crisis has brought unprecedented challenges to Malaysia, the Ministry of Health and other government agencies have employed whole government and what we call as whole society approach despite having a steep learning curve from the onset. So the collaboration between public and the government sector as well as the private sector and the community helps in reducing the cases of COVID-19. Issues and challenges encountered in health promotion. So what are the issues? There's always a lack of public awareness, weakness in the program implementation, constraints in empowering women and specific risk groups, constraints in creating supportive environment, lack of resources, organizational issues, weakness of legislation and enforcement, policies of other ministries not in line with and which. So this is the list of lack of public awareness, because we will have community participation plays an important part. Individual behavior, because with the rise in poor healthy habits, poor eating habits and lifestyles, which will also affect these are the issues which will affect the outcome of oral health and also health in total. And lack of physical exercise and the lifestyles of smoking, alcohol and drug users, and not following SOPs on hand washing techniques, and reckless behaviors, especially in driving and what do you call that, accidents. Number two, there is a weakness of program implementation. Whenever there's a program, we have always to have to train the staff, because the lack of skills and confidence will affect that program implementation. And there's always a lack of ability, high cost in conducting the program, lack of insurance coverage, limited language access, unmet health needs, delays in receiving appropriate care, inability to get preventive services, hospitalizations that could have been prevented, and focus is more on individual and health behavior. So we have to address a person in total when we look at the needs, and it should be a holistic manner. And difficulty of evaluating behavioral change. Number three is lack of resources. Here we have poor information and communication. This is ICT plays a big part. Poor research and evaluation, lack of resources and facilities, or personal skill development. The natural environment plays a big role in the climate change, and built environments such as buildings or transportation, work sites, and recreational settings, housings, and neighborhoods, exposure to toxic substances and physical hazard, physical barriers, especially with people with disabilities, aesthetic elements. Organizational issues in health promotions is still a new paradigm in public health and worldwide. Because patients are always into treatment mindset approach. So there's a difficulty in sustainability, lack of dedicated and specific staff at district level, and poor coordination at different levels. Constraints in creating supportive environment is number 5, in which there's too many launching celebration of health events, but the outcome is not really good. Certain activities do not benefit some target groups, and lack of health promotion projects carried out at community levels. Number 6 is the weaknesses of legislation and enforcement. This is about policies which affect individual and population health. Increasing taxes on tobacco reduces the number of people using tobacco products and can improve population health. But there's always the other part whereby it will affect economy, and at the end, the healthcare cost is much higher, which people do not really look at. Removing the subsidy for sugar will lead to lesser consumption of sugar and reduce risk to diabetes and to caries and other diseases and obesity. So some policies affect entire populations over extended periods of time, while simultaneously helping to exchange individual behaviors. So we have the example is the 1966 Highway Safety Act and the National Traffic and Motor Vehicle Safety Act. Number 7, the policies of other ministries which is not in line with the Ministry of Health. So there is still poor multi-sectorial involvement in education, agriculture, transport, economic, finance, housing, and welfare, and few private sector involvement. Number 8, constraints in empowering women and specific groups. So normally when we have a program, especially the antenatal program, commitment and compliance of women in this program for regular checkup and treatment, because normally it's time factor, because they will normally go for antenatal checkups and have and do not see dental checkup as an important thing, and normally they will just go off after antenatal checkups, which is their first priority. Parents and caregivers to implement oral health practices for special needs children, because these children need assisting in toothbrushing and oral health maintenance. Toddlers and preschoolers program, the parental awareness of the importance of oral health on primary dentition, diet and bottle feeding, and oral hygiene practices. And elderly groups, whilst at dental clinics and outreach services to institution, communities or daycare centers are most established, the provision of domiciliary care has not taken off due to various constraints. So these are the issues and challenges which the oral health division is facing. Why do we have to empower women? Because women must adapt the health promoting strategies for both general health and oral cavity, because the health of a woman's body and oral cavity are bidirectional. So for general health maintenance strategies, advice to minimize alcohol, absence from or cease smoking, stay oral health maintenance strategies, advice, and prevention in a lot of categories. In adolescent women, because of the issues of menstrual cycles, whereby our emphasis on more on advice, so that because these groups are prone to gingivitis and peptic ulcer. And women in early to middle adulthood may be pregnant or using oral contraceptives with concomitant changes in oral tissues. So advice on how to take care of oral cavity during these changes and how to promote the health of infants, including good nutrition. And in older women, the experience of the onset of menopause and increased vulnerability to osteoporosis. So they may experience xerostomia and burning mouth syndrome. So these are the things that we need to help women alleviate this problem and encourage them to continue good infection control and diet practices. Next, we have the issue of healthcare affordability, accessibility, availability, acceptability, and appropriateness. So what do you mean by affordability? It describes whether a person or the organization has sufficient income to pay for or provide for healthcare costs. Access to healthcare means having the timely use of personal health services to achieve the best health outcomes. And availability is defined as the presence of a trained provider or facility providing the services. Acceptability is delivering or receiving a healthcare service. And appropriateness defines care that is effective based on valid evidence, efficient, and consistent with the ethical principles and preference. The challenges of oral diseases. Globally, although oral diseases are largely preventable, they still persist with high prevalence, so reflecting widespread social and economic inequalities and inadequate funding for prevention and treatment. So there's an issue of access to dental care in children living in poverty, socially marginalized group, and older people are most affected. And in low middle income countries, oral diseases remain largely untreated because the treatment costs exceed available resources. When we talk about equitable healthcare, equity is an assessment of fairness. So despite Malaysia's effort in socio-economic development plans, there still exist issues inequity and accessibility, especially for these indigenous groups, rural population, and the hardcore poor. This can be seen through quality in terms of health services, manpower, and equity in terms of geographical location and accessibility in terms of price and tariffs. So this issue of universal access, how do you give universal access? Key healthcare indicators. Measuring healthcare of a nation, we have to have a monitoring plan that can ensure continuous improvement in quality, effectiveness, accountability, and most importantly, affordability. The key healthcare indicators in the current issue of the monitoring and evaluation of strategy for health for all has been categorized under the following four indicators: social and socioeconomic indicators, health status indicators, specific problems indicators, health services improvement indicators. These indicators are found in the Health Facts 2020. 5 key health indicators which are monitored are crude death rate, life expectancy, infant mortality rate, maternity percentage of total MOH allocation to national budget is about 10.3%. And we can find these statistics in the Department of Statistics Malaysia. Policies to reduce non-communicable diseases. So in 2015, we have the Tokyo Declaration, and we also have the WHO's oral health work, focusing on strengthening cost-effective population-wide oral health promotion. So this is the WHO Global Oral Health Report. For Malaysia, we have what we call as National Strategic Plan for Non-Communicable Diseases. This is from 2016 to 2025. It applies an integrated approach. It's essential for effective implementation of the plan, and it includes a lot of action plans and initiatives as listed. Privatization and role of government in healthcare. What do you mean by privatization in healthcare? It refers to the transfer of ownership from public, which is government, to private owners, either from previously government-led properties or from the introduction of new private properties. Privatization policies was introduced in 1983 with the simplistic idea that the rich can afford private hospitals, and this would reduce traffic at government hospitals, allowing them to provide better services for patients. The role of the government is three, which is as a public healthcare provider and a regulator, and also investors in profiting from healthcare. So the healthcare service in Malaysia is changing towards wellness service as opposed to illness service. So the Ministry of Health, being the main provider of health services, may need to manage and mobilize better healthcare services by providing better healthcare financing mechanisms. So we look at the difference between public versus private healthcare in Malaysia. Public healthcare is a cheaper option. However, private hospitals have the advantage over public ones. Many public hospitals are overcrowded from a higher number of patients. Public healthcare, on the other hand, has more doctors due to higher working salaries within the private sphere. So the private hospitals offer faster services for the patients since the ratio of doctors to patients is higher. But the quality of doctors do not differ between the public or private, because medical professions in Malaysia have been trained and educated in modern day best practices in healthcare. So much like medical staff, hospital equipment is of higher quality, undergoing standards inspections from government overseers. Because of the excellence of medical facilities, Malaysia has become a destination for medical tourism, attracting foreigners looking for safe, reliable surgery or treatment for a variety of ailments. So in Malaysia, the private health insurance coverage is usually limited to inpatient treatment or hospitalization. So while the private health insurance, with the private health insurance, there is a possibility that individuals will choose to spend more on healthcare because they know that they are protected, which can cause the moral hazards. So Malaysia's healthcare system is slowly shifting from a largely public sector provided system financed by general revenue sources towards more reliance on private sector services which are financed through fee for service. So opportunities in which the the restructuring of the financial system by introducing national health insurance or co-payment can reduce smaller hazards associated with low-cost system. Strategizing budget allocation in building facilities, implementing inventions and preventive programs based on recent transition in health are important measures to be considered. Quality use of medicine concept and practice and facilities sharing nationally and internationally with neighboring countries also improve access to care. So we have the National Oral Health Plan for Malaysia, which is 2011 to 2020. So these are the key oral health goals and strategies. And in the United States, they have what we call the Healthy People 2020. And they are going towards 2030, in which the oral health plan of Malaysia is also going towards that. So in total, as a reference, these are the references which are used in these lectures, and you could find further information regarding the NSP NCT strategies, health effects will give you information for this is 2020, but it's more information on 2019, and the National Oral Health Plan for Malaysia, the strategies will be there. And you can also refer to the managing how we manage COVID pandemic in Malaysia as a reference. Other than that, we have the Department of Statistics where you can get a lot of information. And with that, I thank you for your time.